This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're here. You know, Thomas, it's hard to believe we're in August and we're still dealing with COVID-19.
Boy, back to school is the big theme now. I know all the teachers are starting to go back and the kids will be virtual through the month of August, but I know that's one of the big themes right now that facing families in North Texas.
Yeah, you know, and we had John Berry on last week, and he made some excellent points, some takeaways I had. Got to really tap this baseline down. Got to get that community spread just as low as possible before you go back to school in person. And the reason is twofold. He was concerned about a winter wave, if you will, that potentially could occur when the cold weather comes and people are inside. His second point, and a point very well taken, and you know, Thomas, we want to let our listeners know right now, probably beginning next month, you can get a flu shot. If you have ever doubted getting a flu shot, please put that doubt aside this year especially. Get that flu shot. You do not want COVID-19 and flu at the same time.
We're still seeing these headlines that COVID is killing people. There was a sad one that you sent to me last week of a family that was right here in the Dallas-Fort Worth area where the 20-year-old daughter went out to a party, got it, didn't know she had it, gave it to mom and dad, and then visited her grandfather. They all were in the hospital, same hospital together, and she went into a coma. She was unconscious for a period of time and woke up 2 days after her grandpa had died. It's one of the saddest stories I've ever heard.
Yeah, it's terrible, and there are more of those. And, you know, Thomas, we certainly express our condolences and our sympathies to all the people that have lost loved ones to COVID-19. But family spread, that's something we need to talk about, because when I talk to the chief medical officers and the physicians that are treating patients, we're seeing more and more family members that are getting infected. And the situation you described is what's happening. People are asymptomatic. They come home. They relax more at home. They don't really wipe off contacts. They probably are a little less likely, obviously, to wear a mask. And as a result, families are getting infected, and it is very, very tragic.
It brings up a couple of thoughts for me. One is we really have to continue to do what we know works because, and you can address this, the numbers I think are down in Texas. At least we've been seeing not as much increase. So hopefully that's a little better, and that's a couple of weeks after Governor Abbott told everybody to wear a mask again. So we know that what we've heard the last 2 weeks from Dr. Haley and John Berry is working.
Absolutely. The other thing I'll mention, Thomas, Governor Abbott also shut down the bars. And while we want to stimulate the economy, and trust me, hospitals want the economy to get back into full swing just as much as anyone. But shutting down those bars also, I think, had a positive impact. The other thing I think we need to bear in mind is when people do wear masks and they do physical distance, according to everything I've read, it could drop the infection rate by as much as 70%. That's a tremendous decrease.
You know, I was taking a little day trip, went up to one of my favorite hiking areas up in southern Oklahoma over last weekend and got outdoors and was very much off to myself on some hiking trails. Stopped at the grocery store to get a little snack to go back home. I prefer that over going to restaurants. And I was surprised at the number of people, in spite of a big sign right on the front door that said, "You have to wear a mask in order to enter the store," and how many people didn't.
Yeah, you know, that's difficult. I think another thing that has helped, a lot of the stores like Home Depot, you've seen Macy's, You've seen a lot of the big grocery chains now say, we really want you to wear a mask before you come in. And while we don't want to really get into enforcement and things like that, the fact that these large retailers are taking the initiative to tell people you must wear a mask to enter our premises is taking a lot of that enforcement away because they're setting the proper example.
Now, the next big thing, if I could pivot here for just a second, is vaccinations, because we've been seeing news on this. We're going to talk about that in this program. We have Dr. Trish Perl, and we talked to her actually it was on the phone, but it was back in February before all of the shutdown, and Stephen and I were together at the same location, and we talked to Trish Perl about kids' vaccines. And we're going to be talking to her in our third segment at the bottom of the hour. And then we're going to follow up with a current conversation about where we are now, including the COVID vaccination.
Absolutely, Thomas. And I know we all are talking about the vaccination, and I look forward to hearing what Dr. Pearl's going to say. But until we get a vaccination, please continue. Don't let your guard down. Continue to wear a mask, physical distance, wash your hands, practice good health habits. It is going to be in our best interest if we all continue that until we do get that vaccine. And let's hope it comes much sooner than later.
What is your gut feel on what's going to happen with the vaccination? Do you think it will arrive, and do you think it will be successful?
Based on my discussions with physicians, I think there will be a vaccine. Whether it's going to be one that lasts for 6 months or a year and you have to get a booster, I don't know. Time will tell. But I do think we will get a vaccine. What I don't know, Thomas, is when it's going to be available to people. Because even when you go through the clinical trials and you get through the third level, you still got to manufacture it. Let's be candid. The whole world wants it. It's not like it's one small area of the country that wants it. It's the whole world. So there's going to be a tremendous demand. How is it going to be distributed? What are going to be the priorities on who gets it first? So there's so many unanswered questions that are going to impact the timing of delivering this to individuals.
I was going to say, if the vaccine were available on Monday and you knew that it was going to be in the DFW area on Monday, how soon would you get it?
I personally would get it as soon as it was available and I qualified to receive it. I would not be one of these people that go, I'm going to wait, see how it goes for 6 or 10 or 12 months. I would be one of the first in line if I met the criteria for that group.
All right, there you go. We're going to unpack this whole conversation. So first, we're going to bring back a guy that you've heard in a couple of our previous shows, Dr. Robert Haley from the University of Texas Southwestern Medical School. And then we're going to talk in the second half of our show for the entire second half with Dr. Trish Perl. She's head of infectious disease at Parkland Hospital and UT Southwestern.
You're not going to want to miss that. This is going to be fantastic.
And if you're out driving around and don't catch the whole interviews, catch our podcast, The Human Side of Healthcare. It's on all the major podcast players. Dr. Bob Haley next from UT Southwestern on COVID spread here on 1080 KRLD
and radio.com.
This is The Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back. Dr. Robert Haley is professor of internal medicine and is director of the Division of Epidemiology in the Internal Medicine Department at UT Southwestern Medical Center. He has also served our military through medicine and spent 10 years at the CDC. So here is Stephen Love and Dr. Robert Haley.
As you look at a lot of the work you do, especially in epidemiology, as you remember, not that long ago, you turn on the TV and we could see what was happening in New York and the people that were being hospitalized, etc. And then they started putting in place different controls, etc. Are there lessons we could learn from New York that would help us here in Texas?
You bet there are. New York and actually 15 states in the country have nearly wiped this thing out, have dramatically reduced it, although in the last week or so we've seen a little bit uptick in some of them, but very small, related to young people getting out. But these 15 states happen to be the 15 states where the governors had declared a mandatory masking policy. So we're back to masking again. That really seems to be the key. Now, some of those also shut down their economy, stay-at-home orders, which you remember we did back early on in April, and shut down what looked like was going to be a New York-style increase, dramatic increase in infections. We stopped that with the stay-at-home order. But a stay-at-home order is paralyzing to our economy. We hate to have to do that. That's truly a last resort. On the other hand, masking is easy. If you wear a mask and everyone else wears a mask, we can all leave our homes, go shopping, go to school, go to university, go to work, and this thing will disappear. And that is the truth. That is easy. It doesn't cost anything but a $6 mask. Now, if we don't wear masks, we can't get our young people to do it, we're going to have to shut down the economy again. Wouldn't it be nicer if we all wore masks and could go about opening up the economy?
I was actually looking at a program on TV where they had an infectious disease physician and an epidemiologist. And they had theories that COVID-19, as we know, originated in Wuhan, China. And they felt like there was a strand that went through Italy that made its way to New York, but there was one from China that kind of made its way to Seattle. And so you still had COVID-19, but they were a little different because they had mutated. Do you think there's any truth to that?
Oh, yeah. That's, I think, well documented. Here's the background on that. All viruses mutate, okay? But they mutate at different rates, and it turns out that COVID is a pretty slow mutator. It mutates, develops mutations, changes in its DNA much more slowly than, say, influenza, which is a fast mutator. And that's why we have to have a different vaccine every year, because it's always changing. COVID is much slower, but scientists can sequence those viruses now. This is becoming very easy to do. And we can know by sequencing. In fact, I just was reading the other day a study where a scientific laboratory has collected 30,000 different isolates of this virus from all different time frames and different geographical regions, and collected all these strains and sequenced them all. And they can now draw a travel map of where this thing has gone by looking at where the different mutations are transiting. So, yeah, we're seeing different little viral strains of this thing branching off and going somewhere, and then they start mutating and differently from another group. And so you're getting that variation, which you can use to map. Now, it's been brought up that, oh my goodness, is that going to make it where our vaccine isn't going to work? Very unlikely, in that the mutation are pretty slow, and you need a fairly dramatic mutation to change its what's called antigenicity, its ability to be attacked by a vaccine. So I don't think that's a legitimate concern, assuming we get a vaccine.
Dr. Haley, they are obviously working toward a vaccine. Coronavirus, we've never vaccinated for the common cold. Can you explain to us the whole vaccine thing? And then that opens up the vaccine debate.
Well, of course, the holy grail of this thing is to have a vaccine that we can give to everybody in the world and prevent them from developing the infection, because then the infection will completely disappear. Okay, that's the dream. Now, fortunately, on the good side of this, we have an arms race just exploding right now to develop the miracle vaccine. There are over 140 different laboratories in the world trying to develop the magic vaccine. 18 of those companies have their vaccine beginning in human trials to prove whether they work or not. And you remember, there are 3 phases to testing a vaccine: phase 1, phase 2, and phase 3. The first 2 phases are in small numbers of people to prove, 1, that they're safe, and 2, that they actually cause the vaccinated people to develop antibodies or immunity to the infection. And then the third one is a very, very large trial, maybe 30,000 people, to show that it actually prevents those people from developing the infection and dying. We have actually, just the first of vaccines has gone into the phase 3 trial just in the last few days. And there are at least 3 more that are getting ready to go into phase 3 trial. People have to realize this is a miracle in itself. Up to now, up to this point, we have never, ever in the history of science developed a successful vaccine from invention to approval and starting to be used in less than 4 years. And some have taken 10 or 15 years to develop. However, the reason this is possible is, one, the Chinese did us all a great favor early on. They very quickly isolated the virus in Wuhan and sequenced the virus's genome. So we have a map of the genome, which they quickly disseminated to the world. This was a great thing, and I don't think people appreciate this tremendous feat very quickly. This allows our manufacturers of vaccines and laboratories developing vaccines to go into the genome of the virus and develop a vaccine clearly on a computer, so they can find what is likely to work. What about that virus can be attacked, and then how can we develop a vaccine that will attack it purely in the laboratory? Okay, and they can do it quickly, and that's why this is moving at such a fast pace. In fact, there are 4 or 5 different mechanisms or different ways a vaccine could work, and all of those are being exploited by different labs all over the country. So not only do we have 140 labs working on it, but many of them are taking diverse paths. So if one path doesn't work out, if one method doesn't work out, one of the other methods might. So this is an unprecedented vaccine development. That's on the good side. Now, on the bad side is we've tried to develop vaccines to coronavirus unsuccessfully in the past, to other coronaviruses, cousins to this one. And there are other viruses that are similar, like the HIV virus, for example. There has been a huge effort, very similar to what we're seeing now in COVID, to develop an HIV vaccine, and it's never been effective. They've had a lot that seem to produce immunity, but in fact, when you try it in humans, it just doesn't prevent infection or death. So the chance any of these are going to be effective is not 100%. In fact, some people have put it at 50-50 or something like that. So I think the bottom line of the vaccine thing is we need to hope for this. We need to support these financially through our governments, and they are doing that. But we must not count on it to control the epidemic. We must develop and implement our public health measures, our masking, distancing, hand washing, and stay-at-home orders when necessary. We must rely on those because those we know can work. If we get a vaccine, that's all to the good, but we can't wait for that.
We have over 30 minutes of our conversation with Dr. Robert Haley on our podcast, The Human Side of Healthcare. It's on all the major podcast players. Probably your favorite has us on it. Now, when we come back, we're going to continue this vaccination theme. We're going to talk to Dr. Trish Perl. She is Chief of the Division of Infectious Diseases at UT Southwestern Medical Center. We're going to air an interview we did back in February, right before COVID hit. But the information is as relevant today as then. It's all about, should you vaccinate your children? A big debate for some, a no-brainer for others. Dr. Perl weighs in next on the Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back. We're going to talk now with Dr. Trish Perl. She's Chief Division of Infectious Diseases at UT Southwestern Medical Center. This is an interview we did back in February, so you won't hear COVID mentioned because we weren't talking about it back then. But the information that we discussed with her then is as relevant as today. So much so that Dr. Perl will stay with us into our next segment to bring us up to date on the latest developments with a COVID vaccination. But first now, Stephen Love with Dr. Trish Perl tackling the question of should we vaccinate our kids or not?
You know, we hear a lot, we read a lot, and I think there's a lot of unknown related to the vaccination debate. Why is it important to provide in a timely manner vaccinations throughout a child's childhood?
You know, what people may not recognize is that there are two public health interventions that have been done more to enhance the world's health than anything. And one is the development of clean water, and the second is vaccination. It has been remarkable what we have been able to accomplish in terms of decreasing deaths and significant morbidity or complications from infectious diseases in really the past 100 years. And I think that recognition is really important in terms of how these have really impacted the quality of life and the length of life in the United States.
So for our listeners, especially the parents, but also family members, nieces, nephews, etc., what would you recommend for the children? What vaccinations should they receive?
So there's a standard group of vaccinations that are recommended for all children. And these are commonly offered by pediatricians. They're free. And they have been developed because these were the diseases that were most likely to either kill or harm them. And they include tetanus, pertussis, diphtheria, which is now called Tdap, measles, mumps, and rubella, or MMR. We currently give influenza vaccination to children over the age of 6 months. We are currently giving them hepatitis vaccines, which is very, very important. And we are finally giving them some other vaccines for bacterial diseases that include Haemophilus influenza. In some children, they'll be getting a pneumococcal vaccine if they have certain risks. And then in older children, they're offered additional vaccines, including meningococcal vaccine when they become teenagers, the HPV vaccine when they're in the 10, 11-ish range. So there are different vaccines. But what I would also say is two of these vaccines actually not only prevent infectious diseases, but they actually prevent cancer, which have been remarkable developments. So the hepatitis B vaccine as well as the HPV vaccine not only prevent infection, but cancer.
You know, that's so important. And, you know, we're talking about children. I am very blessed. I've got 3 wonderful grandchildren. But I remember when my first grandchild was born, I went and got shots before I saw. Can you elaborate a little bit on why grandparents for the first time should make sure they're up to date on shots?
So there is something called a cocoon effect where we want to protect people who are vulnerable. So in this case, we're talking about young children. A lot of them will not be able to get vaccines until they'll start their vaccines usually when they're about 2 months old. There are some vaccines we can actually give earlier, but they will not be fully immunized and protected for a significant period of time. What we try and do in those particular cases is vaccinate those people around them to basically form a cocoon and protect the children from any of the infections that could potentially circulate. So one of the best examples might be the measles, mumps, and rubella vaccine. So you can't give that to a child, or we don't give it to a child, except in very unusual circumstances until they're around 15 months old. And in that case, if we can protect the grandparents and the parents, then is a way of cocooning that child and protecting them from the infection. Same thing is true with pertussis, which is probably one of the vaccine that you were given. We as adults are the common. I mean, we sort of get pertussis as a mild cold for us, but we lose our protection or our antibody to it after 3 years, and so then we could get it again. But because we have mild symptoms, we could inadvertently give it to a child, and very young children actually die from pertussis. It's a serious disease for them. So what we do is we vaccinate the grandparents. That's a long answer to try and explain the rationale behind vaccinating at all ages.
You did a great job, and you're exactly right. Those were the vaccinations that I did receive. You know, I introduced this topic as the great vaccination debate. As a layman, it seems to me there's reliable scientific information available. But why do so many people and parents still question vaccinations or vaccines? Do you have any thoughts on that?
You know, there is really a lot of interesting, I will say, data out there, and it revolves around a lot of issues. But one is that people just don't know. They don't know the data behind vaccines and how important they are. We, as a medical community, I mean, that includes me, have not been able to translate this importance into simple words to help them understand how important it is. Second thing is that, you know, as medical care has changed, we have not valued, you know, paying people to take the time to actually educate parents. You know, it takes 30 minutes to go through all the pluses and minuses and whys and whatever of vaccines, yet we're not reimbursing physicians to do that kind of work, which is very, very important because people listen to their doctors more than anyone else. If your doctor says, I'm going to vaccinate your child, that is a huge clue to the parent that you think this is important. Third thing is there's a lot of misinformation out there, and I don't have any sort of magic wand to tell us how are we going to counteract the misinformation. But I think there's been a lot of damage done by people who say that vaccines are associated with autism. I mean, the data are just so strong that show that there is absolutely no association. And we haven't been able to counteract that effectively and just say that data is wrong and these vaccines are extremely safe. So I think it's, you know, there are a lot of reasons out there, but those are some of the primary things, and I think we just have to become more effective communicators. We have to value the communication, and we have to get the facts out there.
You know, you're so right. And speaking of facts, our listeners may not know this. 1 in 9 children live in Texas. We have many children. We're very blessed to have those children in Texas. Unfortunately, many of those children are eligible for coverage through Medicaid or CHIP, and for whatever the reason, their parents may not get them enrolled, which worries many providers. Are they getting their vaccinations? So Where can parents go to get vaccinations for their children to ensure that they do the things you just talked about?
There are a lot of ways that you can get vaccination. You can get vaccination, obviously, from your healthcare provider, from your pediatrician, from your nurse practitioner, from your PA, wherever you go to seek medical care. I think people should understand that these vaccines for children are free. Second thing is that they can go to public health departments. Most public health departments actually will have clinics where they can get vaccinated, and they love to do that. Some public health departments even will have mobile opportunities where they'll take these around. There are a lot of schools that actually will support and provide access to vaccinations. So there are a lot of ways that you can get access to vaccines, and it just really requires you trying to determine what the resources are in your particular area. And if you don't know, you can call the health department. Their job is to make sure that we improve vaccination rates all over the state of Texas as well as throughout United States.
This has been Dr. Trish Perl. She is chief of the Division of Infectious Diseases at UT Southwestern Medical Center, and she's professor and chief of infectious diseases at UT Southwestern Medical School, which is renowned as one of the top medical schools in the country. And when we come back, she's going to rejoin us for our final segment to bring us up to date on the COVID vaccination situation. Will we ever get one? And if so, by when? If you've missed today's interviews with Dr. Perl and Dr. Haley, they, along with all of our full-length interviews, are on our podcast channel. It's The Human Side of Healthcare on all your favorite podcast apps. And we'll be right back here on 1080 KRLD.
And radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is The Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome to The Human Side of Healthcare. We're delighted that we're going to continue our discussion related to vaccinations. And of course, we've got Dr. Trish Perl with us. And as we've said before, she's the Chief Division of Infectious Diseases, and she's professor at UT Southwestern Medical Center. And we're going to continue our discussion with her. We're going to pivot a little bit and focus in on, can you give us your general thoughts and overview of how close are we to a COVID-19 vaccination?
So I don't have a crystal ball. And what I will say is that the good news is that we have several vaccinations, at least 5 that are in what we call phase 2, phase 3 clinical trials. So they have been shown, we develop immunity to the vaccine. Now we actually want to see if they're protective. Those clinical trials have started. So that's phase 1. We've got to get this part of the vaccine effectiveness assessed. If this goes well, then potentially vaccine would be available early next year. Not for everybody. It takes quite a while to ramp up the supply chain, but that would be the earliest. The cautionary note in all of this is that there are vaccines that we have taken into phase 3 before and have not proved effective. And the most famous one is HIV. So I think everyone is hopeful. It's great that we're at this point, but I do think we have to also recognize that just because we are in phase 3 clinical trials doesn't mean that we've got an effective vaccine as of yet.
You know, those are some good points. And I think one that you touched on that our listeners really need to stop and think about is the supply chain. I mean, stop and think. The demand for this hopeful vaccine for COVID-19 is really the whole world. The whole world wants the vaccine. So the supply chain management of this, the priorities of it, are just unbelievable, and how it's going to be disseminated. Let me pivot just a little bit. When you get a vaccine like this, based on your experience, could it potentially last, I'm making this up, 5 years, and then you have to get a booster? Or do you think it's something you might have to repeat every year, or is it just too early to tell?
It's a little early to tell. This is an RNA virus. They commonly are not as immunogenic, if you will, as some of the other viruses. So flu is another example of an RNA virus. So this may be one of those vaccines where we will need repeated doses. We do know that a couple of the vaccines that are currently being trialed, you actually are getting a repeat dose, and you need that for it to be effective. But whether or not that needs to be repeated yearly or every couple of years is not known at this point. What I will say is we're beginning to get a lot of information about the immune response, and I think that some data is forthcoming and that we will be able to make some projections relatively soon, just based on getting some of the human data that's come out related to the pandemic and the studies that have been done within the pandemic.
You know, you read a lot and hear a lot about at least 2 or 3 major drug companies that are almost entering or beginning to enter the clinical trials at the 3rd level, like you were talking about in clinical trials 3, as we call them. Is there a possibility we'll have more than one vaccine?
So there is absolutely a possibility that there will be more than vaccine. There are currently multiple vaccines that are being tested in phase 3. At least one of those is being tested in the United States. 3 of them are not actually being tested in the United States. And what data the U.S. FDA accepts will depend on whether or not that vaccine will be accessible to U.S. participants. So I think what we do with the data and what clinical data we accept will really depend on which vaccines are ultimately licensed in the United States.
You know, that's an important distinction. You understand what it has to be. And I'm sure a lot of that, we'll certainly try to expedite, but the good news is at least we're moving in the right direction. Let's pivot just a bit. Last week, John Berry talked about one of his big concerns was really tapping down the baseline of COVID-19 and getting it as low as possible, get his community spread down as much as possible before the fall, because his fear was a wave. And he also worried about the flu. Do you have any thoughts related to flu vaccine? Should we take it this year? And for our listeners to get some advice, I would think most people this year, if any year, should pay close attention to getting a flu shot.
I would say yes. And I think that John Berry is absolutely on target, that there is not only a risk that we would have another wave in the fall, but we're going to have that wave on top of the time where we have a lot of other respiratory viruses circulating, whether it's influenza, whether it's respiratory syncytial virus. And so it's going to be much more difficult for us to differentiate clinically what to do with people. And it's going to be harder for people to know, when do they stay home? How long do they stay home? What would be the appropriate course of action? So, yes. And to answer your ultimate question is should you get an influenza vaccine? Absolutely. It is always very important because even if you don't think you can get the flu, somebody around you could, and that person could be immunocompromised or not able to take the influenza vaccine. So it's very important this year for people to do that.
We had your colleague on a couple of weeks ago when we talked about COVID-19 and influenza, Dr. Haley, and he indicated influenza, when it gets in the schools, is quite serious because children are spreaders of influenza. So I think that's another good thing to consider. As we open schools and we're concentrating on COVID, we can't lose sight of the flu either.
Exactly. Absolutely.
So to kind of wrap up a discussion on vaccinations, let's kind of turn the mic open to you, give you an open mic. What would you tell our listeners as a final thought related to vaccinations, influenza, and the upcoming fall?
We do know that we get an influenza epidemic every year. It is reliable. We never know how serious the epidemic is going to be. But nonetheless, we know that while not perfect, the flu vaccine actually does decrease the severity of symptoms. It can decrease your chances of being hospitalized, especially if you have certain underlying conditions. And it can decrease transmission to people who are at risk of complications. So we think it's very important. Flu symptoms can mimic those of COVID. And so when we enter a situation where we could have dual viruses circulating, and if you can minimize the confusion by being protected for one, it's going to be helpful in terms of not only your own health, but also guiding the medical community in what treatments we may or may not need to use on you, as well as how the epidemics, the dual epidemics are evolving should there be another wave of COVID.
And over the last 2 weeks, we've aired several interviews here on the Human Side of Healthcare from medical experts in infectious disease and epidemiology, and one of the top pandemic experts in the world, saying that if we will all just do our part and wear a mask and physical distance and wash our hands frequently, then we would prevent that second wave of COVID-19. Come on, North Texas, we can do it. That's the message of all the North Texas hospitals. Let's work together to stop the surge. Be safe. We'll see you again next week on the Human Side of Healthcare.